Welcome to DentiMax. In this video, I'm going to cover the kiosk and the web kiosk and how it relates to COVID-19 and taking the appropriate precautions to question your patients and make sure that you're doing the responsible thing as those patients are coming in and out of your door. There's a few different layers of information. So first, I'm going to start with setting up your DentiMax system for a COVID alert. I've already done some of the legwork, but I'm just going to walk you through the different pieces so you understand the parts of the program that may be impacted by the COVID-19 intake or questionnaire and the data that you might want to plug in here and there. So to begin, I'm going to go to the settings screen in the top right corner and go to Set Up Alert Codes. And you'll see that I added a new alert, and that new alert is for COVID-19 symptoms. It's important that you'll have the option to flag your patient as having COVID-19 symptoms, because even though they may not be coming in while they have those symptoms, if they've had them and then they call for an appointment later, you'll want to find out if they're still having any symptoms, if they've been checked, and what their status is. You can, of course, make other alerts relating to COVID-19. Name it whatever you'd like. You can have one for symptoms or diagnoses, anything that you feel is relevant, and you can flag your patients with or without the kiosk for having those symptoms, just so your staff is alerted that they may want to pay attention to that for that patient or have some follow-up questions for that patient as well. So whomever has the ability to add in alerts, you'll want to definitely put something in the system for COVID, as it's not something that's a flash in the pan that's seemingly going away. That'll be an important piece of information to carry forward outside of their initial registration. Once you're done adding the alert, I want to talk about the Document Center and how the Document Center can be used with or without the web kiosk. So if we go to the top right-hand corner and click DC for Document Center and open that up, there's a couple of different forms I've already created and added to the system. If you would like a copy of these forms, please email training@dentimax.com and they'll be happy to supply a copy that you can copy and paste into the Document Center for your own use. There is a little bit of formatting that you'll have to do, so just keep that in mind, but we're happy to supply the base information for you. I'm going to go ahead and just pull up my own record here, and under Patient Letter, if we select Add Patient Letter, in the Document Center, you could click New and add in the new document once you have it, or if you've already got a COVID-19 questionnaire you'd like to add to the Document Center, feel free to go ahead and do that by clicking New and giving it a name and saving it into the Document Center. I already have a couple of options here for a COVID-19 questionnaire. This first one can be used without the kiosk. And this is something that if you have the Document Center in your practice already, you can have the patients electronically sign off on this questionnaire. If we go ahead and hit Use Selected, I'll show you what the patient will see if you pull this up on your screen and you have them review it and sign it. At the top, of course, is my practice information. I've got a title for the document. It's a screening form. I've got today's date that merges in. I have my patient name that merges in and the patient date of birth as well. I have instructions to read the below questions. You'll be asked to sign in the true section below if all of these statements are true and accurate. If you cannot answer true to all of these statements, please sign in the false section. So on my document, I have it set up to where there's two different spaces to sign. One is true, one is false. The patient only needs to sign one of those spaces. Signature 1 is going to be for true. Signature 2 is going to be for false. If they answer false to these questions, you may want to reconsider if you're planning to keep that patient in your office that day or send them home or send them to the doctor to get checked or get tested for COVID-19. These are the fairly standard questions that you've seen across the U.S. at various locations. If you do have other things you'd like to add to this questionnaire, you're welcome to get the copy from us and then modify it however you'd like to use the document. but we'll just run through these quickly together. And these are the same questions we'll have in the other spaces in this video, so I won't continue rereading them. This is the core data that we're trying to capture. I have not traveled outside the USA in the last 14 days. No one that lives with me has traveled outside the USA in the last 14 days. I have not traveled within the USA in the last 14 days, meaning out of state, outside of going to your job and the regular grocery store and places you would normally travel to. I have not been on a cruise ship in the last 14 days. Neither myself or the patient, if the patient is somebody else, has been in close contact with anyone who has traveled domestically or internationally in the last 14 days. I have not attended any events or gatherings with more than 100 people in the last 14 days. I have not been in close contact with a person known to have the 2019 novel coronavirus. Neither myself and or the patient have been asked to self-quarantine. I do not currently have a fever or low respiratory symptoms such as cough or shortness of breath, and I do not have a new onset of cold symptoms such as a cough or runny nose. All of these are indicator questions as to whether or not the patient may have had any kind of exposure to COVID-19. And of course, once again, you can add or remove any of these if you find them not to be relevant or something that you don't want to use, or if you have additional things you'd like to add. Once your patient reads these questions, they can sign to affirm that all the above statements are true, and their signature will go here. Or if they cannot answer true, they'll sign in signature space number 2. And of course, there's a little blurb down here at the bottom as to where to get additional information regarding COVID-19 or the coronavirus. Once your patient has read the questionnaire and is ready to sign either under signature number 1 or signature number 2, you'll click sign here at the top of the screen, and it initially prompts for signature number 1. If the patient is going to sign under signature number 2, all you need to do is hit the cancel button, and then it allows you to choose if they're going to sign under signature number 1 or signature number 2. So if they're going to select signature 1, you could click the sign now button and have them draw their signature. If you've got a signature pad in the office, you can have them use that for a signature, or they can also use a touch screen if you have a touch screen capability. And once they're done adding their signature, you can hit the done button and save. If they were going to sign under signature number 2, you would have skipped number 1 and gone to number 2 and hit sign now and have them sign their name under signature number 2, which means they cannot answer true to one or more of the statements in the above section. Once you're done, you're going to save your changes. And as you can see, the document does save. In this example, you'll see both signatures, but on the document the patient signs, there should only be one, either true or false. And then if the patient would like a copy, you can go ahead and hit the print button and print out a copy with their signature on it of what they have signed. The great thing about the Document Center questionnaire is that they don't have to check yes or no on every single item. It's a statement instead of a question, and it automatically saves inside the Document Center, and it can be used for new patients or existing patients without having the in-office kiosk or the web kiosk. That's one document that we're happy to supply to you. Now let's take a look at the other. If we click Add Patient Document, we have the COVID-19 questionnaire that is formatted specifically for the kiosk, which once again, we're happy to supply you with a copy of that. And if I go ahead and hit the Use button, it has the same merge fields on there. It has the same sort of formatting and statements that they could answer true or false to. And you'll notice here that there's a space for signing that the statements are true. And if the patient gets to the end of those statements and they cannot sign true, it's asking them to type the word alert in the place of their signature instead. That way, if they're completing this document through the in-office or the web kiosk and they cannot answer true, since they can't choose which space to sign, there's only one space for a signature, they can type the word alert to indicate that it's false. They cannot answer true to those questions. I'm going to go ahead and show you this document in the kiosk. I just wanted to give you a preview of where it should go and how I separate that out from a patient sitting in my chair already in the office that's not filling out the kiosk. Or if they just walked in the door and they're going to use the in-office or web kiosk online ahead of time, they can complete the questionnaire from their home or from the tablet that you hand off to them when they walk in the door. So this document is specifically formatted for the kiosk, whereas the other document can be used with the patient sitting in the chair just in Document Center by itself. Once you have the documents in Document Center, you can then link them to the kiosk, either the in-office kiosk or the web kiosk, or both if you do have both. And I'm going to go ahead and show you that next. So exiting the Document Center, I'm going to pull up the kiosk from my desktop, which is the Patient Registration Manager. I'm going to double click on that shortcut and go to the Settings menu of the Patient Registration Manager. Once we're here, I'm going to go over to the Documents to Sign section, and you'll notice that I have the COVID-19 questionnaire for kiosk listed there, and that it does require a signature from the patient, and it is marked to be available to use online and in office. And I want that to save into the signed document section of the Document Center. Please keep in mind that you cannot use the kiosk without having the Document Center, because those documents and those items have to come from the Document Center and then they get saved to the Document Center. So if you're wanting to use the kiosk, either in office or web kiosk, you will need to have the Document Center from DentiMax. Once you have the document in Document Center, at the bottom of the screen you would click Add Document, choose which document you want to add as a signable option for the patient to acknowledge through the kiosk, and then click Use Selected, and then it loads it up there for you to select if this is for new patients only. And if you require a signature, and if you're going to use it online or in office, and where to save that document to in the Document Center once it's completed, and save my changes. So that is how you can link a document from Document Center onto the kiosk as a document for the patient to sign. The next component I'm going to cover is setting up the customizable page for the in-office or the web kiosk to do the questionnaire built into that custom page instead of a separate document. Some offices may want to do both depending on how many precautions you'd like to take, and other offices are going to have a preference for one versus the other. I will recommend that you have a COVID questionnaire in your Document Center for those patients that may not use the kiosk, and you can have them sign off on the COVID questionnaire from the Document Center as a standalone. But if you do have the kiosk in office or web, you probably are going to want to set up the customizable page to be more of a questionnaire for COVID. To get into that section, I'm going to go ahead and click back in the Settings menu. And then right here on the Options tab, there's a section to edit the custom page. So I'm going to click that. At the top, we have all of the standard pieces of information. So the general information for previous dentist and physician. And if we scroll down, we have the dental history section, medical history section, and then a woman's section. At the bottom, I went ahead and added the COVID questionnaire, and I wanted to show you how I formatted that. If you click Add Line, it'll give you a new space to create a new section or line item in that custom page. You can see that the section I chose for the COVID questionnaire was Main Title as the type, and then I went ahead and typed in COVID-19 questionnaire. Next, I clicked Add Line again, and I chose Yes or No question, and then I typed in the question that we have from the questionnaire, which once again, we can supply you with a copy of this. And instead of this being a statement, since the patient does have the ability to answer yes or no, we went ahead and made it a question. So have you traveled or the patient traveled outside the USA in the last 14 days? This automatically will give the yes or no answer when the patient uses it because we formatted it to be a yes or no type question in the type section. You can also make this a required question, so the patient will not be able to continue past this custom page until they select an answer just by clicking the space bar or checking the checkbox right there in the required box. And then you'll click Add Line and continue adding your yes or no questions as you go. I will point out that there's one section that the question was extra long, so I had to use 2 different lines to complete that question. The first line, I just made a heading, and then the second line is where they'll be able to answer yes or no. So you'll see that when we go through this questionnaire on the web kiosk, how that shows up in the formatting. And all of the rest of these, I went ahead and made those required fields, along with anything else that you might want to make a required field. I'm going to delete this extra line here at the bottom. Save my changes, which is what you'll do once you're done formatting this, but keep in mind you can click the preview button if you want to see how that's going to look on your screen. It takes you right to that custom page, and if we scroll down, we'll get to the COVID questionnaire section. So you can see that line is empty where the question is not complete, and then they answer on the next line down. So that's a good way to just check your formatting and make sure you've set up the kiosk questionnaire in a way that works for you and that reads well to the patient. And of course, if you do need additional assistance, you can contact the training department and they'll be happy to help plug some of this in for you or help clean up anything that you might need help with. Once you're done making your changes, click Save. And then if you do have the web kiosk, you're going to click the Update Web button. By default, when you hit save, it'll save it for the in-office kiosk, but you do have to push that update to the web if you have the web version. So we'll click Update Web. The update has been completed, and then we'll hit the Save button to save any other changes we've made. Now I'm going to go ahead to my web kiosk online, and since I don't have a website, I have no handy button to link patients over to the web kiosk, so I'm going to use the website that we have set up, epatientcenter.com. I'm going to go ahead and plug in my practice name, which for my demo account is just Alicia. And as the patient, filling out my new patient registration online in advance before I come to the office, I can do this registration on my smartphone or at my computer at home and get that done ahead of time so I don't have to arrive at the office early. Anything in yellow is a required field, and the patient will be alerted to that if they try and continue without filling out one of the yellow sections. You'll see that it tells them, please complete the required fields that are marked in yellow. We'll go ahead and just enter some dummy data here. And if the person doing the registration does have the autofill turned on their computer, they can go ahead and have that information populate right into the kiosk without having to type it all in, which, let's face it, everybody prefers the convenience of that these days. And the patient will be able to select whether or not they have insurance. And of course, you'll be able to pull in this data into your system. To get to the COVID section, I'm just going to go ahead and say no to insurance and move forward a little bit faster. This is asking who's responsible for paying the bill for that patient, the responsible party. I'm going to say the patient is. The next section is the medical alerts. So we can go ahead and use the shortcut and click no to all. And this is where, when we've updated the system, the patient will also be able to select whether or not they've had COVID symptoms on this alert page. Keep in mind those alerts are coming from your DentiMax system. We'll continue on to the next page, which is going to be our customizable questionnaire. And if we scroll down to the bottom, there's our COVID-19 questions. The patient is required to answer yes or no to everything that's in yellow because I set that up to be a required field, and then they can click the continue button. And last, we've got our documents that are coming from Document Center. The first document I had in there is my HIPAA form, so the patient can go ahead and sign off on HIPAA. And then continuing on to the next page, if instead of the custom page, adding the questionnaire there, you added it to a document in Document Center and linked it to the kiosk, this is where the patient would either sign off that all the statements are true, or they would type the word alert if they cannot answer true to one or more of the statements above. If you get someone who fills out the word alert instead of their signature, that should be a flag to you that you might want to screen them a little bit further before you allow them to come into the office. So I'm going to type the word alert there and hit continue. Once I'm done with my registration, I hit the submit button. Once the patient has submitted their registration, it gets sent to your DentiMax system for you to import and review, and then the patient gets routed to your website or whatever designated space you've told the system to send them once they're done. Going back into DentiMax, in the bottom right corner is where the clipboard is, and that's where we're going to see our registrations. So I select that, click Download Web Registrations, and you can see all the registrations pop in. I'm going to scroll down to the bottom to look for the newest ones. So here's the one I just completed. I'll click Save to DentiMax, choose a patient file to save it to, or create a new patient. Since I did the online kiosk, it'll be for new patient data. You'll be able to review everything that they entered. Click over to the next page, and so on. And you can see when you get to the document section, if they had filled out the COVID questionnaire as a document instead of on the custom page, that in place of a signature, it says the word alert. So immediately I can see that before importing the data and call that patient and say, I see that you entered alert under the COVID-19 questionnaire for your registration. Tell me which item you could not answer yes to, and explain if you're symptomatic, and just dig a little further and get the answers you need to decide whether or not you're going to bring that patient into the office. Once you're done reviewing all that data, you can update it to DentiMax or save it to DentiMax, and that patient data import was completed. It'll save a copy of that data not only as a patient in DentiMax, which you can see my gender, birth date, phone number, but if we go to the Document Center, we'll also be able to see their full registration as something that they completed today. So there's the patient registration data that you can scroll through and see how they answered the customizable questions or any alerts. The alerts do import into the system as well. And then separately are the documents that the patient signed as well. I hope this was helpful for you to put into practice some of the COVID precautions and questionnaires and how to use the system in a way to address those issues. And we hope that you and your practice are staying healthy and are moving forward in a positive direction. And please, if you have any additional questions, contact the training department at 1-800-704-8494 or email training@dentimax.com for additional assistance. Thank you.